Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today, it is my distinct honor and privilege to be speaking with the man, the myth, the legend, Dave Sharar, CEO of Chestnut Health System. Dave, welcome.
Well, thank you, Charles. I think you embellished that introduction a little bit.
Well, I've known you for a little over 20 years, which is a pretty amazing thing to think about. I've always thought of you as the quintessential Midwesterner, pretty low-key, modest, self-effacing. So I figured I'd immediately get you out of your comfort zone with a little bit of a bombastic open day. But I'm sure you'll be able to recover. In any case, really great able to make some time to talk to me about this today. I mentioned when preparing for this that I wanted to make the theme of today's conversation a line from a favorite play of mine by Tom Stoppard called Rosencrantz and Guildenstern, where one of the characters says, "Every exit is an entry somewhere else," which I thought was appropriate for some of the broader themes that we're going to be talking about, because we are speaking as you prepare for a new role with the organization after a long and distinguished 30-plus year career with Chestnut, 36 to be exact. Yes, Dave?
Yeah, that's right. If my math's correct, Charles, that's right. I started in 1989.
Wow. Well, we'll get to your new role in a bit. I figure we leave our listeners on the edge of their seat. But first, sorry?
I do love the quote, though.
Yes.
Yeah.
Yes. Yeah, very apropos. But first, again, you've been with Chestnut for so long, Dave. We sometimes forget that there was a BC before Chestnut period in your life. So maybe we should start there. What were you doing with yourself before joining Chestnut, and what led you to Chestnut?
Yeah, Charles, my whole career, even after graduating high school, and I think it was 1979, my first job out of high school was a camp counselor for underprivileged kids for the Illinois Sheriff's Association. I did that for a couple of summers, and different officers from counties would bring kids over that they thought were at risk or might get into trouble, and they'd have several week experience out in the wilderness. And that was kind of my foray into the helping professions. And when I became an undergraduate, I worked in the community mental health field. At that time, it was when the end of deinstitutionalization was happening, and that was the closure of state mental hospitals around the country, with the philosophy that those patients were better off reintegrated into the community. Now, the funding didn't necessarily follow, but it was a really interesting time because there were people who were in state hospitals for decades, truly institutionalized, and they were now in the community and needed to find a place to live, needed to stay on their medication, needed to have something to do during the day. It was really a drastic change for them. And so I worked with that group, and I did some focus really on just vocational training, like what's it like to have a job? What's it like to have a job skill and hopefully get a paycheck? And work was such a meaningful part of just trying to exist. And many of them were just, not employable at the time. Mm-hmm. And so I started out, really in that space, and they were pretty menial jobs, like sorting and packaging and shredding and that kind of thing. But at least a lot of these former patients had something to do, had some structure, had something to show up to, a little bit of purpose. And so that was really, my entrance into all of this.
I see. Then when and how did that intersect with Chestnut? Well, we know when.
Right.
We know when.
Yeah. So out of graduate school, at least my master's program, my wife we wanted to stay in Central Illinois because our family and parents were here, aging parents. And so she landed a job here, and I just followed and saw an ad in the paper that was really related to occupational work. And I gravitated towards it and had an interview with my boss of, 40 years, Russell Hagen, and got a job here at Chestnut. Started out in the area of what we now know as employee assistance, or really occupational behavioral health.
Some of our listeners are non-specialist listeners. You and I have been marinating in this space for quite a while, so we take it for granted that people know what EAP is, but maybe you could give a succinct, handy definition for those who are not familiar with EAP, what an EAP is.
Yeah, sure, Charles. Thanks. It is an employer-sponsored program that allows employees and their family members really free access to services, with a professional for any kind of personal problem. And it's really voluntary. It's free. They don't have to have a diagnosis. They can just call. And these days it can be in person or virtual, but they can talk to a professional about whatever's going on with the belief that unresolved personal problems negatively impact productivity and focus at work. So there's that piece of it. The other part of it too is that sometimes work conditions, the work environment can also perpetuate some personal issues, poor relationships with supervisor or difficult work conditions or harassment at work or these kind of things also create access. So those two dynamics go hand in hand, and these programs are really designed to help people get back on track and become productive in their
Mm,
role. So it was really somewhat unique for a not-for-profit like Chestnut to offer this service as one of our service lines. It was more of a commercial enterprise.
right, right. Well, I tell you, generally speaking, when you're in a field for a significant length of time, it becomes real hard to describe what you do in a succinct way, but I think you did a very good job of that, Dave.
I went on a little too long.
No, that was good. So, speaking of with Chestnut, you pretty much did it all: intakes, assessment, short-term counseling, referrals, follow-up case management, supervisory training and consultation, critical incident intervention, workplace substance use policy development, account management, proposal writing, sales presentations to prospective employers. Have I missed anything?
No, and that was all really in the employee assistance area, Charles. When we started out here, it was myself and a couple of colleagues who stayed here. One of them retired and others are still here. So it was a small group of us that just kicked this off. We were lucky enough to land an agreement with a very large multinational company, late 1980s, early 90s, that thought this was a good service. It was relatively
Mhm.
concept. And we did it for one of their plants in Decatur, Illinois. And they said, we like it. Let's do it everywhere. So all of a sudden we had a large company, a Fortune 100 company that said, we want to do this in all of our locations. So having a client like that, and this particular client was Archer Daniels Midland, launched us. That gave us the platform
Sure.
to start to sell to other employers. So that was really the beginning of, and at the time, their main concern was employee substance use, alcohol use. The head of labor relationship, we got a lot of drunks working in those plants. Can you guys help us clean this up? So that was the start.
Yeah, yeah. Well, it's pretty amazing to be able to land a client like that so early on. Obviously, it lends validation, makes it a little bit easier to go to market and sell these services. Of all those things that I mentioned that you've done over these past 30 some odd years, what do you enjoy doing most?
I'd say, Charles, probably, during this employee assistance era, really trying to grow that business line, trying to sell companies on what was unique about the way Chestnut approached this service. We had to differentiate ourselves from, competitors who were for profit and very large and sometimes parts of insurance companies. And here we are, an agency in central Illinois. So I think coming up with our value proposition about how and why we were different, and then persuading others of that, and then trying to realize that was a really important part of what I did. But the early days, I really enjoyed going to these different plants and meeting with supervisors and union reps and talking about how to find, workers in need and trouble and refer them and get them linked up. All that worked very well, but then you might recall that it was in the 90s and even into the 2000s, this country, in the private sector experienced what I'll call a tsunami of drug testing. Drug testing kind of took over, as a way to identify workers. In the old days, we identified them based on job performance problems and a voluntary referral as a way to avoid termination. And then drug testing came along and some employers decided to terminate. We fought hard and argued against that they needed to provide these employees who tested positive an opportunity for treatment and recovery, just like they support employees who have heart disease or cancer. So that was another interesting thing about the job, was just trying to educate employers on the value, of endorsing treatment over disciplinary action and termination.
Yeah. I'm going to throw a curveball at you. We know that there are upsides to being with an organization for as long as you have. Are there any downsides?
Well, it's true that you can get comfortable with the familiar and a little bit resistant to a risk or a change. Although Chestnut was so diverse, we have so many different service lines and we had so much growth that I never felt like I was stuck in, a closet in an organization. So I think some would see, these days people change jobs with a lot more frequency. You don't run across tenure as long as mine that much anymore. But the downside might just be that you become a little bit risk avoidant. Um,
Mhm.
Maybe you kind of get so familiar that you don't embrace change like you could. But I never felt that way here. I always felt like things were moving, that I was never stagnant.
Yeah. Yeah. No, that's well stated. If I may put a bit of a personal gloss in this, Dave, as I mentioned, we met in the early aughts, so over 20 years now. And I most associate you with your work on what I have to think are two of your signature achievements, your work in developing the Workplace Outcome Suite, WOS, and the global EAP that has since been acquired, Chestnut Global Partners, which introduced the glocal model of EAP delivery to the world. First, tell our listeners about the WOS, what it is, why it's such an important tool in the industry, and your role in helping develop it and distribute it or implement it.
Yeah, that really was kind of a signature project for me, Charles. Of course, it was a collective endeavor, and there was a lot more brains besides me behind it, including, real scientists like doctors Richard Lennox and Michael Dennis, both who were part of Chestnut and knew how to create scientifically validated tools. So in the employee assistance arena, there really wasn't a lot of the measurement of true results of what we did. Instead, it was a focus on features and low price and not much information really that was credible on the actual outcomes of the intervention itself. So we knew that most employers cared about work performance. So we created a tool we called the Workplace Outcome Suite. We tested it, we validated it, we published it, we did it correctly to measure the workplace effects of intervention, the impact on absenteeism, presenteeism, work engagement, workplace distress, all of these factors that cost, employers money and time. And so we decided to really measure that and not just do it for Chestnut as part of our differentiator, but give that tool away to the entire field with the idea that we would all start using the same yardstick. So Chestnut, with our research division known as the Lighthouse Institute, we had analysts there, statisticians. And so we just started to push this tool out to other employee assistance entities and taught them how to use it as a pre-measure and post-measure. The tool is administered before the EAP intervention and then several months later as a follow-up. And you just look at the difference, and calculate that and produce a report. So we offered other EAPs a free analysis if they used our tool and shared the data with us. So we built a warehouse, and gradually over time, it became about 30,000 cases, which is a big number from
Sure.
a variety of EAPs, internal, external, international, domestic, small, big, and all of these kinds of things. So we collected this and produced reports on the efficacy of what we do. So we didn't quite succeed in the effort to have employers place outcomes ahead of low price, but that was our
Right.
idea, that employers who had better outcomes should be paid better, deserving of a higher rate. That was kind of the point. But anyway, it was an exciting project, and a lot of people were involved, and it kind of became the tool that most EAPs embraced, who really put the effort into measuring their outcomes.
Yeah, which tees up, of course, the next question I want to ask you about the global model. But let me just make a comment, if I may. I don't want to embarrass you, Dave, but you talk about using this tool, giving it away to promote it as a benchmark and essentially have more or less a universal benchmark. And again, I've known you for a good many years now. And over that time, you really have been a tireless, vocal, consistent, and I should say, effective advocate for this industry, for EAP, for outcomes, for putting a premium on outcomes, because as we know, a lot of EAPs over this period of time kind of have gamed the system to some extent. And I think that you've always had, I hesitate to use the word purity, but you certainly had a clear, unwavering, and I think unassailable vision in your advocacy. And I just wanted to make note of that as we're sort of talking about going from one phase of your career, an exit, and entering another phase. So I hope I didn't embarrass you. It's something I think needed to be said.
Well, thank you, Charles. That was very kind. And yes, although we didn't succeed, it really was a great project. And that whole notion that what is value? It's outcomes achieved relative to the price incurred, right? So that was what we tried to. The EAPs were a very inexpensive benefit, but the outcomes achieved, were far superior in some ways to the money employers spent on other benefits.
Right.
And so hopefully employers put a little bit more of a premium and didn't, ignore that particular service. So Chestnut still offers it. We still have one for our own employees. We sold that EAP enterprise in 2018. So we've been out of that business for, several years.
Right. By the way, my comments about your advocacy, not so much being kind as it is, quite frankly, in being accurate, because, I've seen it up close. So the glocal model, describe to our listeners what that's all about.
Yeah. And so when we had some of our larger multinational organizations ask us to export what we do here to the time when there was a global economy and a lot of U.S. multinationals were overseas, setting up plants and services. And so it started out with the recognition that some of their expats had a hard time adjusting to a new country and a new culture and didn't always succeed. And many times their families that went with them for an assignment did not make it. They wanted to return home. They didn't know the language. They didn't have a network of support. They didn't know their way around. They weren't comfortable. They didn't feel safe, a variety of reasons. And some expats would go and get into trouble, quite honestly. So we were hired to intervene in some of that and try to provide support and try to keep people engaged. So that was the beginnings. And then there was a realization that if we're doing it for expats, we might as well do it for the local workers in that country. We understood that centralizing a model in the US and making everybody call back here and trying to engage language lines and all of that didn't make a lot of sense. That you really wanted to build local partnerships with practitioners that knew the community and culture and country and the way things worked and engage them in doing this employee assistance concept and really trying to adapt the Western model to fit with local cultural context. So that was the beginnings of the glocal model. A person who we mutually know, Ken Burgess, was quite instrumental in helping us jumpstart all of this. And we worked with Ken while he started an EAP in Sao Paulo, Brazil, and went down there and helped build services there. So it was really Ken Burgess who embraced the glocal model, and I think we built the profile for it.
So in 2018, you became CEO of Chestnut Health Systems. Was that a difficult transition?
There was some difficulties, Charles, for sure. I mean, I'd kind of been in this commercial world. I started out with, people who had a lot of disability, intellectual disability, cognitive impairment, mental illness, substance use. I moved into the commercial world, but there were a lot of people there with similar problems, right? And some were working poor and some made a lot of money. But it was a transition away from the commercial world back to the public sector, publicly funded treatment, understanding was a lot different when an organization like ADM or Caterpillar paid the bill, and now going to state government, federal government, grants, Medicaid rates, these kinds of things, and adjusting to that. Just an organization as the size of ours with the number of service lines and getting a full appreciation for everything that we did, was an adjustment. Now,
Did you have a leadership philosophy coming in, or did that evolve over time?
I think I did have one coming in. I've always tried to have a philosophy around inclusion and participation and not having a hierarchy, an autocratic style where all decisions were made from only the top leadership, but you really realize that the best way to get things done was to give people autonomy, particularly leaders and program directors, give them a lot of autonomy to do their job, but to have some sense of strategic direction and, to really try to over communicate, provide more information than less. It's not always easy including everyone in every decision all the time, because some you have to make fast and some you can't involve everybody. But when something impacts others, you do your best to make sure they have a say, a chance, to put forward an opinion or a perception and incorporate that in your final outcome, as long as it
Sure.
doesn't take too long and get too clumsy.
Yes. What would you say are some of the biggest challenges during those 8 years as a CEO?
So, things started out, pretty well. And we kind of focused on, in the beginning, around Chestnut had a lot of growth and a lot of service lines, but those service lines weren't well connected. They kind of operated as independent business units in some way. And so we really believed in integrated care. We really believe that with all of your podcasts, you've heard this, a lot of our patients and clients have multiple conditions. They don't come in with usually one condition. It's not unusual for, a patient with depression and alcohol use disorder and diabetes, and they've never seen a dentist, right? I mean, this kind of thing is not uncommon. So we believe that we needed to combine all of our service lines into an integrated care model. So that was really a huge challenge and one that all of our leaders embraced. But then the pandemic hit, right? And that pummeled us for a little while, but we pivoted pretty fast. That was a huge challenge because all of a sudden you didn't have clients and patients showing up. You had residential units, you had housing units, and you have to furlough staff. And then after we got through all of that, suddenly there was a huge workforce shortage, so those were a little bit of a distraction, just trying to stay the course, when you had a strategic plan of integration and growth, but we eventually got back on track.
Is there any one piece of advice you would give to your successor?
Well, I think my successor is well positioned and prepared, but and he knows all this, but it's to stay visible, over communicate, include others who are impacted in decisions, keep your board of directors engaged and feeling like they have enough information, to make good decisions. Putting the patient and client first is huge, but also making sure that you do everything you can for staff to feel appreciated, recognized. They need to have a sense of purpose here, a sense of mission. We're not a for-profit, so everybody that comes here, they deal with more difficult cases, more difficult clients, more bureaucracy, more documentation, more rules. So we want them to know that the work that they do is important, and then figuring out how to grow in the midst of all these financial challenges. We can't just raise our rates because we want to, right? We have to have legislation to raise our rates. And right now we're in a particularly challenging time with the current federal funding environment. So reassuring people that we've navigated these turbulent waters and we'll do it again, so they don't feel insecure. And I would say recruitment and retention is a huge, huge issue for every organization like ours.
Sure. So, Dave, now that we've spent all this time keeping our listeners on the edge of their seats, in October you will be stepping down as CEO and you'll be transitioning into a new role with Chestnut's Lighthouse Institute. Tell us about this.
Yeah, and I've always, you mentioned earlier, Charles, the Workplace Outcome Suite. So I've always stayed somewhat involved with our research division, which is really, makes Chestnut quite unique. It's a very unusual thing for a community health organization to have a research institute as large as ours. They've had a strong focus in recovery and substance use disorder and integrated care. And so I'm excited to go work there and bring back my historical focus and passion, which is really the workplace, behavioral health in the workplace. And that includes the workforce shortage problem. It includes the growing number of individuals who are, quote, working poor, but now have threatened access to publicly funded coverage like Medicaid. How do we ensure they have access to behavioral health care? And it includes looking at what's going on in the workplace to prevent and intervene with behavioral health conditions and how to, increase productivity like I used to do in the old days. So I'll be focused on I think we're calling it the Behavioral Health Workplace Innovation Center of the Lighthouse Institute.
Excellent. Excellent. Very exciting. It feels like it's sort of a summation of a lot of the work you've done to date, no?
Right. And
So,
you know how it is, Charles. There's way too many people to name. You can't do it, right? There's just too many people who have been positive influences, and you can't list them all. You'll forget somebody. But I do want to acknowledge, Russ Hagen, who was our former CEO. I worked under him for many years, and he saw some potential in me I'm not sure I saw in myself. I never really had aspirations for this role, but he had it for me, and it worked out. And so I really owe him a lot of gratitude for giving me this opportunity. His name's Russ Hagen.
yes, indeed. And by the way, this podcast is not intended as a summing up of your career. That would be too big of a thing to do, but I'm glad we had a chance to sit down and spend some time going over some of your career highlights, how you came to this work, your passions, your achievements. And again, I had a little bit of a front row seat at some of it, so that was a great privilege and honor for
Well,
me personally, Dave.
you've been giving me a lot of compliments, Charles. So you helped us build our profile in those early days. And when we sold that enterprise, everybody thought we were a lot bigger than we really were.
Well, well, that's a bit of a left-handed compliment, but I will take it.
Yeah,
Any,
no, it helped us, right? It helped us. Yeah.
Yeah. No, again, remarkable career. And obviously it's not over. You're just moving to a new thing, a new chapter. Very, very, very exciting. Eager to see how that unfolds, Dave. Again, congratulations. And I know I speak on behalf of all your colleagues, everybody who's worked for you, with you over these many years. Kudos and all the best.
Yeah, thank you, Charles. I appreciate this conversation so much.
Same. Thanks. This is Charles Epstein for the Catalyst Podcast. Today I spoke with Dave Sharar, the longtime Chestnut Health Systems major domo, CEO, and now moving into a research position with the Lighthouse Institute. And he's got a lot of important work ahead of him. Looking forward to that as well. Thanks so much for listening. See you again soon.